Hello all. Uh, Welcome all MRCP aspirants. I am Dr. Varun. I am a senior consultant in internal medicine at Fortis Hospital, Amritsar. Uh, I did my MRCP way back in 2016, and the pattern of examination hasn't changed much. And it does open a lot of avenues for you if you want to gain more and in-depth knowledge of internal medicine. And of course, if you want to do a good practice, a standardized practice, even in India or in UK, it is very important to understand that MRCP is a worldwide recognized uh, course, and the degree is valid almost in around 160 countries throughout the world. So you can actually make the world as your playground if you want to practice medicine on a higher scale, and it does make you a better doctor also. So let's see if we can reply to your queries today. Whatever we all think before taking up this examination, there's so many doubts because obviously there is a lot of expenses involved, and we need to understand the mechanics of the exam and how to clear it in the best possible manner. So once you are very well prepared, along with you have got a good motivation and a confidence in yourself that you can clear this exam, only then one gets a greater chances of passing through. No wonder this is a difficult exam. The passing percentages are pretty low. To begin with MRCP Part 1 written exam, the cutoff is around 400 and I think 20 marks, 520 marks. And for MRCP Part 2 written, which is a little lenient, you can have a cutoff of around 420 marks. So PACES, which is actually the backbone of this examination, is conducted with actual live patients. So there are no dummy patients here except for the one in the history session, his history taking section, or in the section where you have to do a consultation. So that could be a patient in agony, that could be a patient who has a lot of questions. So they give you scenarios. So those scenario patients can be the dummy ones, but otherwise you will get original patients who have multitude of problems, be it neurological, be it cardiac, be it respiratory, be it abdominal, be it endocrine. So you will get actual patients. So unless you have done a good work with your clinical skills, there are chances that you may fail PACES. So having said that, let's begin with the questions. So whether to take MRCP after graduating or after post-graduation. See, MRCP is an exam of internal medicine. So they actually certify you that you, on the scale of 1 to 10, you have done a good job in your practice and learning of internal medicine. So it is better if you are post MD, because after doing your post graduation, your level of thinking, the way you respond to patients' queries, the way you respond to the history taking, and the more skills you add on, that helps in clearing MRCP exam. Unfortunately, in India, apart from the people who are graduating from very good institutes, it is very hard to find new residents who have cleared their graduation and are ready to practice medicine. So basically, this exam will be beneficial for those who have done a lot of clinical work, and along with that, they have an in-depth knowledge of medicine, and those who have a lot of interest in doing something like MRCP. Is it worth doing vis-a-vis post-graduation in India? I think that is an open debate. So in MRCP, you actually get a degree with which you can practice as a consultant in India. However, if you want to go and practice in UK, there is a pathway laid down by the NHS through which, even if you have completed your MRCP, you will need some years to be invested into the system so that you can get a specialist grade, and then you can become a consultant there in the UK. However, after doing MD in India, you can actually practice like a consultant, as well as you get a degree as well. So these are the only basic differences. Otherwise, I think if you have done post graduation, then it is better to do an MRCP. It is an add-on inventory in your collar. Along with that, it will enhance your skills at arriving at a diagnosis, and it will make you a better physician. After graduation, you can do it if you have in mind the thought of going and practicing in UK, because that certainly will help. Because after graduation, you have a lot of time at your hand. Postgraduate people have already spent 3 years in their post graduations, so they have a different agenda to do MRCP. This MRCP UK got certified and was included in the National Register in 2016. So once you've done your exam and you get your degree, you can actually apply in your respective medical councils to get it registered, which is a valid way of getting the things done. Once you are registered, it is at par with the MD medicine. And in some corporate hospitals, it is considered a step above MD medicine. So you can actually do that. However, not many institutes in India allow a post-graduation course, I mean, super specialization after MRCP. So that is a catch. But if you want to practice, you don't require a CCT in India. However, if you want to practice in UK, as I told you, you will require a certificate of core training in UK to become a specialist. Uh, More so, MRCP is actually considered as a important step to join in for subspecializations. So it is a criteria to be fulfilled to join in for subspecialization. So once you go to UK, you clear you after passing your MRCP exam, you are cleared by the authorities that okay, fine, this person has done MRCP. Now we can put this patient into a registrarship into respective departments like renal medicine, acute medicine, cardiology, and there's so many of them, all the subspecialties. And if you prove your proficiency and CCT there, then obviously you will become a super specialist or a subspecialist, the way you would want to put it. So MRCP is an important step along with the CCT in UK. But in India, this is doing an MRCP itself is a valid enough qualification as of now. The CCT is not required to get it registered in your medical councils. People who have done post graduation in medicine in our country, they can very well attempt a specialty certificate examination right away. Although for specialty certificate examination, there is no guideline that you must complete your MRCP UK first. So you can actually attempt and write the specialty examination directly as well. However, in the broader context of things, it is better to be well versed with the medicine first and then go into a specialty certificate course. That will help. Otherwise, it is the level of confidence that you can generate after a genuine step is always better than just completing, or because there is no formal training involved. This is very important. If you are doing MRCP, obviously you are doing some kind of residency somewhere in any hospital. Even if you are doing your own OPD, that is a way of learning more. So MRCP helps there. But imagine if somebody had to do a specialty certificate examination directly without any formal training. It is always, it always gives you a weaker connection with the subject that you are in if you have not done enough hands-on with that. It is better to have to do MRCP first, or any training in internal medicine before taking up a specialty examination. It is always worthwhile. Now, a lot of people are doing rheumatology specialty certificate examination after MBBS. I have seen few. So they basically they feel that because rheumatology has a lot of lacuna in our country, so people prefer doing it directly after MBBS. But we have to understand that unless you have a hands-on practice, as I always keep on saying, learn to before you appear in an exam. So when you are actually seeing patients of rheumatology, be it in any setup, then you can do that. But after clearing your graduation without clearing MRCP, that means you are moving at a pace which is missing out on some things. It is not literally, moving along a path. It is somersaulting, and it will not help you in a long way because patients, they don't give you many chances to prove your worth. So if you have done your graduation, post graduation, and then a subspecialty examination, that really helps directly as a doctor, as a physician. I think that is a somersaulting, and you can actually get stuck in somewhere during practice. So, like any other professional exam, you need to have two subsets here. One is the theoretical knowledge, and the other is the practical knowledge. When I say the practical knowledge, it doesn't only encompass the clinical skills that you perform, like we have all the steps of doing the clinical examination, be it abdominal, be it respiratory, be it cardiac, be it neurological, but then how to speak with the patient, how to communicate what you want from the patient, how to understand what patient is telling you, how the communication travels, how to close that loop of communication, how you brief them about their disorder, how you counsel them, how you pacify them if they have any questions, which many times they are irritating to us, but as a doctors, as a physicians, we have to keep our calm too, because we are there to do something for the person. And if they've come to you, they want a solution, they are trying to understand you, you also try to understand them. So that part you will lack if you don't connect with the patients. So to connect with the patient, you obviously need a place, and it is good to be in a hospital setting where you get a lot of patients. The outpatient department is one part, but indoor is one part. In indoor, the patient is there in front of you for like 3, 4, 5 days. So if you have missed out something in the first examination, you can always go back and do the examination again to find another findings in the same patient. So it is good that if you do it, and if you can get a mentor, very, very important. A mentor who is a very good physician, who is a very good teacher, if you can find one, then obviously there is no other step better than this to join in a hospital, be it a government hospital, be it a private hospital, a corporate one, any place. And then along with that, you start preparing for your exam. In fact, MRCP also wants you to have at least 1 year of experience post primary medical qualification to be in your sleeves before you start appearing in the exam. And so that will make it very, very assured that your path is clear, that you do your written exams also and a clinical exam, because it is not just a written examination, it encompasses unlike USMLE where dummy patients are used. This is a postgraduate level examination, so they want to assess you on the on the criteria of clinical examination as well. So it is better if you join in an organization, in an institution, and prepare theory as well as your clinical skills. So as far as theory is concerned, you obviously would require experience with the people who've already cleared examination, who already know how the questions come. Just by preparing it from the books, it doesn't help you much, because the questions, they are patient oriented. So again, the onus and the focus is on patient interaction. The more interaction you have, easier is the exam to clear. So those who are preparing for MRCP written, I think joining an academy is a very, very important thing. Not that because I'm talking through an academy is it important, but having a person, having a team of people work with you, working on you, is very important these days. There's so much of information on the internet, there's so much information on the books. Sometimes you get lost in the gamut of things. So if there is somebody who can guide you and take you and steer your path on a particular subject, and then take up your queries as well. Imagine if you don't have anybody aligned and you have certain queries about a subject, and if you try to ask somebody the authentic level of information that you would require for your queries, you will find it very easily in these educational academies who are preparing people for MRCP. So I think you need to sort out in which academy you want to study, get connected with them, get some notes, make your own notes, listen to what these academics, the faculty people have to tell you. They know almost everything because they've been in the business for last 7, 8 years. So they've been teaching students, they've been reviewing the examination process, they've been trying to get into the changing pattern of questions as well, so that they can train their students for the upcoming exam or the diet, so that they do not feel as if, where did this question come from? So medicine is an ever changing branch, and sometimes the notes that we get from the market, they are pretty static notes, whereas the teaching that is provided by the academies is a very dynamic one. So the teacher is also, the faculty is also well adept to the latest guidelines, the latest recommendations. And this MRCP exam, it encompasses so many of nice guidelines, nice as in the organization nice, that you have to stick to them while you are answering. So in India, you can say anything. Like, for example, if they give you a picture, a scenario of a patient who's coming to you for the first time with an HbA1c of 7.0. So what is the next best step? If you ask me, by going by the guidelines, the answer may be something different from if I would have to answer from my day-to-day clinical practice. Examination understands the language of only guidelines. So how would you come to know about them? It is always better to join an academy, to start preparation, so that you don't feel lost, so that you are spot on the target and you have good deadlines. Because academies also try to prepare you on a guideline, on a deadline basis, so that you are actually ready for the exam when you are going for the exam.